Good morning, everyone. Thank you so much for joining us this morning. I want to thank all of you for the work that you're doing in your hometowns and counties and for taking some time out of your day to learn a little more about some of these laws that are changing rapidly and significantly. We are here today to talk some about the Families First Coronavirus Response Act, also known as FFCRA, which is a tough acronym, and some changes to unemployment insurance in Iowa. We're going to focus particularly on HR and payroll type questions. And I would encourage all of you to keep sending ISAC staff your questions. We got this idea from some questions that came up. If your county is having a question, you're not the only county having those questions. And I realized I should probably introduce myself. For those of you, I know we've got some city folks on here today as well. I'm Christy Harshbarger. I am general counsel with ISAC. So that's where we got the idea for this webinar. And we are looking for other suggestions, and we're hoping to have other content like this. So definitely let us know your feedback about how today went and if this was helpful and other things that you might want more education and training on. I also want to thank our speakers today. They're doing a lot of hard work to stay up to date. Like I said, all this stuff is changing rapidly, so it's a lot of work to stay current on what the latest guidance is. I'll be on here as a moderator, and so if you have questions, you can send those in via the question function. You can just type those in and we'll get those and we can get those addressed. I think we decided that we're going to kind of do them as they come in, so feel free to send any question as soon as it pops up. And I will let the speakers introduce themselves and get started. We can just go in the order for intros as is on the first slide. So Aaron, Ann, and then Lisa. Thank you so much.
All right. I'm Aaron Hilligas. I am an attorney at Ahlers and Cooney. Do a lot of labor and employment work for counties, cities, school districts. And as with, I'm sure all of you guys, the COVID-19 and the employment-related issues have been occupying nearly all of my time, and so it's a new world for us all, and hopefully we can provide a little guidance with respect to all of this stuff. Looking forward to speaking with you
all. My name's Ann Smisek. I'm also an attorney at Ahlers and Cooney, along with Aaron. We're part of the labor and employment practice group. Yes, trying to stay on top of all of this has been a challenge, but we're doing our best and trying to share our knowledge with you all as best that we can to push information out. Even though a lot of the times our answers right now are we're not sure or I don't know, we're trying to give you our best guesses on things and staying up to date on stuff. So glad to be with you all today, and thank you for taking the time.
Hi, I'm Lisa Mart. I'm the Human Resources Specialist with the Iowa League of Cities and IMWCA, and just trying to echo the other two. There's a lot of changes and everybody struggles to understand it, so we're just trying to help. Call your attorneys if you have questions. Hello?
Are we ready to go?
Yeah. I can't remember. Is Christy doing the slides?
Yes.
Okay. Yep, I will click through. Just let me know.
Okay. Well, this is Aaron, and I'll start out going into this. I'm sure all of you are aware of the FFCRA, and what's the shorthand that I usually have used for it is the emergency sick leave, emergency family leave, just as the shorthand there. But that was recently passed, and it's applicable April 1st to December 31st. And what this included is a couple different leave provisions that I'll go into. At the bottom of this slide, what you'll see is there's a less than 500 employee requirement that only applies to the private sector. I'm not exactly sure why they cut off coverage in the private sector for employers who have more than 500 employees. But so long as there's 500 or less in the private sector, those employees are covered. In the public sector, just actually got an email this morning from a large public sector employer who they had read some information in the National Review that indicated that the expanded or emergency family leave provision does not apply to public employers with more than 500 employees, whereas the emergency sick leave does. That's wrong. So if any of you read that article in the National Review, ignore it. The federal regulations are clear. Both the emergency sick leave and the emergency family leave apply to public employers regardless of the size. Next slide, please. So as I alluded to, there are two different types of paid leave that were established. There's the emergency paid sick leave and the expanded or emergency FMLA leave. So with respect to the emergency paid sick leave, there are a few different categories that I'll go into on how this applies. But just some of the highlights with respect to it is if you have an employee who starts, say if it's even a temporary employee, that employee would qualify for the emergency paid sick leave, which is up to 80 hours of paid time for a full-time employee. And a question that I've received about that is, let's say I got it with respect to police officers they're scheduled for 56 hours in a week. So do they get 56 hours because they're for that week because that's what they're normally scheduled? And the answer to that is no. What the law specifically said is for full-time employees, it is 40 hours. 40 hours for a week or 80 hours for that 2-week time period. Once you reach the 80 hours, that's exhausted. Now, with respect to the part-time employees, that's a little more malleable. You will look at you'll take a look back period about the average for a part-time employee going over a period of time and take that average. Or what is done if it's a newer hire and it's unknown, it would be what the intent was in terms of the hours at that time. And really, I think there, what you need to show is just a good faith compliance with respect to those provisions. Now, in terms of the emergency paid sick leave, what you'll see under the 6 qualifications, those are the categories that I'm going to discuss in the following slide. But what there is in terms of the importance there is the monetary amount. There are a couple categories of emergency paid sick leave where an employee is entitled to receive 100% of their pay up to a daily limit cap for that. And then there is another category of that where, or actually 3 more categories of that, where an employee is entitled to only 2/3 of their rate of pay. And there's a dollar cap of that on a daily limit of $200 a day. So that's the emergency sick leave provision. Yes.
Aaron, this is Lisa. I'm going to interject here. For everybody to understand, the full-time, part-time would also include seasonal hours, correct?
Yes.
For seasonal employees. So I just want to make sure that we have a lot of counties that employ seasonal as well as cities. This is including your seasonal employees. And
that's absolutely
if you have
correct.
minor,
basically, if someone is hired as an employee, they're entitled to the emergency paid sick leave.
And there's no age limit, like 18 and over. It would include if you have a 16-year-old doing something, or 18.
Yeah, I see the law, yes. Yeah.
That was my understanding as well. I just wanted to make sure everybody knew that. Thank you.
And Aaron, we did have a question come in. I think maybe this comes up in a later slide, but the question was if this time has to be taken in 8-hour increments.
8-hour increments? No. No, it doesn't. There actually is, there's the ability for the emergency paid sick leave to be taken in an intermittent fashion for a child care purpose. So there's, I just think as it would apply as it normally is. If someone is regularly, if they're a full-time employee, they're entitled up to 80 hours. Part-time, more or less the average there. So it's not, I think you just comply with the regular sort of hours that employees get.
And
we'll
we have
talk
a
about
slide on
intermittent
this.
more.
Yeah, where we can talk through a couple of examples because it can get confusing, but we can do that. We've got a slide on that.
Okay, ready to move on? Okay, so the other category of paid leave that was created is the emergency or expanded family medical leave. And this only kicks in after an employee has been in place for 30 days. And so, it's a little different than that emergency paid sick leave, which takes place immediately. So an individual is entitled to up to 12 weeks of paid leave. And it really depends on the, it's highly dependent, oops, I lost this window, sorry. It's highly dependent on the prior usage of FMLA. So where this created a special category of 12 weeks of paid leave, it does not mean that employees are entitled to an additional 12 weeks of leave on top of the prior FMLA amounts that they had. So if an individual, let's say within the prior 12-month period, had exhausted all of the FMLA leave, then they would not be entitled to any of the expanded FMLA leave. Having said that, if there was a qualifying provision, they would be entitled to the emergency sick leave. But that's just one sort of clarification there. The expanded FMLA, and I'm going to go into these qualifications that's on the slide, but there's only one reason that applies. And basically it's for child care closure or school closure and the need to help take care of the child. So can we go to the next slide? Okay, so as I mentioned previously, there are 6 different categories of the emergency paid sick leave. And within that, there's the category where and those categories are if an employee is quarantined per federal, state, or local authority. And there is some question about what that means in terms of state or local authority and what a quarantine is. And it's a pretty broad definition, but it remains to be seen what it is. There's an argument that the current situation where we are about the not congregating in groups of greater than 10 and things like that, that it could qualify there. I don't quite see it that way, but there is an argument. The second category is if an employee is advised to self-quarantine. Their doctor tells them that you need to go home, you need to quarantine yourself. And the third one is that an employee has the symptoms of COVID-19 and seeks a medical diagnosis. So the other category there. Now, if an employee decides to, if they have the symptoms of COVID-19 and do not seek a medical diagnosis, it doesn't apply. So that's one thing to take into account. Now, the other category where employees are entitled to a 2/3 rate of pay, up to a $200 daily limit, is if an employee is caring for an individual who is subject to either category 1 or 2 on the column on the self-quarantine. The other one is the next one, number 5, is if an employee is caring for a child, one of their children, due to the closure of school or childcare, and that's the that directly relates to the same thing about the expanded FMLA leave. And then the third category there, number 6, would be if an employee is experiencing similar symptoms of COVID-19, and the additional language there is as determined by the United States Department of Health and Human Services. There has not been any sort of identification by the Department of Health and Human Services at this point in time. So technically number 6 doesn't apply at this point in time because there has been no determination. So there are really 5 categories that apply at this point in time, and this chart lays out how it would be paid out. Now, in terms of the expanded FMLA leave, just want to be clear that it only applies to the circumstance where an employee is caring for a son or daughter due to closed school or childcare. So under that, as you mentioned previously, they're entitled to 12 weeks of that expanded FMLA leave. The first 2 weeks of the expanded FMLA leave are technically unpaid, but the purpose of number 5 in the chart above with the paid sick leave, it's intended to have that be utilized there together. So they could have the continuous pay at this 2/3 rate of pay. Now, one other item to point out about the expanded FMLA leave, just to reiterate, this does not mean, because it's paid for this particular purpose, does not mean other FMLA leave purposes are paid under this. There is not that requirement.
Aaron, we have had several questions come in. I don't know if you want to touch on some of those now. Yeah, so there's a couple different categories that have come up a couple of times. One is, so it looks like a lot of cities and counties have something other than 40 hours set as their regular full-time work week, something less than 40 hours, so 35, 37 and a half. How does that work in terms of that 40-hour or 80 hours total?
My take on it is I would pay them what they're normally paid. If they're normally paid 35, pay them 35. I don't know if anyone else has any take on that, but that's.
This is Ann. Yeah, that's correct. So the 80 hours is really a 2-week equivalent. Anybody that works less than 40 hours in a work week is considered part-time under the FFCRA. So if you work a 35-hour week, even if you're considered full-time for benefits purposes, you're only entitled to, 70 hours, whatever your 2-week equivalent is for that emergency paid sick leave.
And then I think that might touch on the other question that came up a couple of times is if someone's part-time and they work variable hours, what time frame do you look at to get that average?
You're supposed to look at, sorry, go ahead, Aaron.
Oh, I was going to say it's the prior 6-month period that you looked at.
6 months. All right. Let's see if there's other ones that we need to touch on right now. There was a question about workers' comp. I don't know if we want to touch on that now or wait for that later.
Workers' comp?
Yeah, so somebody asked if they were exposed to COVID at work, do they qualify for workers' compensation?
I don't know, and I think it's one of those it depends things, sort of things. I know that I heard from a workers' compensation provider that there's a causation sort of question. It's difficult to determine whether it was in fact caused at the workplace versus you going out to Heidi or something like that and picking it up there. And so the indication was if they cannot establish that there was causation at the actual workplace, then they would not cover
it. So this is Lisa. So the COVID-19 virus is a communicable disease or virus, such as the flu, the mumps, the measles, and so my understanding is that, the Iowa workers' compensation law is not really clear on whether it's an occupational disease or an accidental injury. It all, like Aaron said, it depends on the facts and circumstances that, and any, if it's going to be compensable or not is going to be on a case-by-case basis. So, the employee would have to show that their condition did arise out of their employment. If somebody does think that they have a claim, or they should still report it with their workers' compensation provider, and then the claim staff assigned will do an investigation to see if it's compensable or not.
Okay, and then one other one we had, if the public health nurse in the county is sending employees home because they might be exposed, does that fall under category 1 on this slide? Does that count as a local authority sending folks, quarantining them?
I don't read it that way. Let's see here. I'm just looking at the administrative regulations for the language. It just indicates that that a quarantine or isolation order, it includes quarantine, isolation, containment, shelter in place, or stay-at-home orders issued by any federal, state, or local government authority. I don't read an employee nurse telling someone that they need to go as a local government authority. But I mean, it's something that the key here is there's going to be a lot of litigation related to this. There are so many gray areas. The administrative regulations were largely cobbled together. It was necessary for them to be cobbled together real quick because the law took effect on April 1st, which was 15 days or 14 days after the law had been passed and enacted. And in terms of federal regulations, that is incredibly fast. So there's not a lot of detail here. I think in a normal environment, we'd probably see 800 pages at least in terms of administrative regulation. Here we only have 124. So in terms of administrative regulations, that's not a whole lot with what's a convoluted law. So they talk in generalities. They don't go into specifics a whole lot. So, my personal take on it is that the nurse would not qualify as under that, and so category 1 would not apply. I don't know if anyone else has it.
This is Ann. I'll jump on that one too a little bit. No, I don't believe that category 1 is triggered by an employer, even if it's a public health nurse or something, sending employees home. It would be like if the governor issues a shelter in place order, number 1 would be triggered if it applies to your employees. The other piece to this, which we're going to get in a couple slides, is that, public health nurses, public health employees, as well as other emergency responders and healthcare providers can be excluded from this law. So we'll talk about that more later. But I also want to emphasize here, if an employee is afraid to come to work because of exposure, none of these are triggered. If they don't want to come to work and they're afraid, they can use their vacation or personal leave. If you guys are, a lot of employers are being more generous with sick leave right now. And if you guys are in that category and you want to allow them to use sick leave, that is fine. But none of these are triggered when someone is just afraid of exposure. Now, if they are a high-risk individual, say they have asthma or some type of pre-existing condition that makes them more likely to suffer complications or death should they get it. If they go to their healthcare provider and provide a note, or maybe they don't even have to go, if they just contact their healthcare provider and they provide a note that says they have a compromised immune system or because of a pre-existing condition, they should self-quarantine. I believe number 2 there then is triggered. But just because they're afraid or they themselves feel like they're high risk, if they don't get some kind of documentation from their healthcare provider, this emergency paid sick leave is not triggered.
Hey, Ann, this is Lisa.
Yeah.
So I would also add to that if an employee, so if it's not a case of like 1 or 2 where the doctors told them to quarantine, if an employee does have, has a fear about being in the workplace and does have a pre-existing condition or a serious health condition, that maybe wouldn't be something that would make them high risk for this, but maybe mental illness or something that won't want them to be, you would also, if you're an employer with the 50 threshold, you would have to look at traditional FMLA in this situation.
Correct. That, yes. And that's a good point. And really, when you any situation when someone's calling in or requesting some type of COVID related leave, you really need to look at it on a case by case basis. See if one of these are triggered. If one of these aren't triggered, or say one of these are triggered, but then they go through their 2 weeks and still can't return, you would then need to look at what your existing policies are. You still need to consult with FMLA to see if it would qualify, for some type of protected leave under that.
And also another consideration is not to muddy the waters too much. There's also the American Act component as well that may need to be taken into account.
So kind of along those lines, we had several questions come in about what sort of documentation you can ask for related to this, particularly category number 4, but any of them?
We'll get to that in a couple slides. I know that.
Okay.
Yeah, so let's hold off on that one.
All right, sounds good. Some other questions, and I think maybe we cover this later too. Do we have to exhaust PTO before this leave kicks in?
No. With this, if there's actually a specific provision that for the qualifying reason for any of those qualifying reasons, the emergency sick leave occurs first. That's to be utilized first there. So you can't require them to exhaust all of their other sick leave first. Now, one question that we frequently get is, pertaining to the use of other leave is if an employee can utilize or if an employer can require an employee to utilize additional leave in those the categories where the pay is only at 2/3 amount, if that can be utilized in order to effectively make the employee's paycheck whole, so they're making 100%. And our guidance there is that it's that we suggest both parties agree on that. There's, in terms of the emergency sick leave with the 2/3 component, neither one, an employer cannot require an employee to utilize that sick leave in order to bring it up to a 100% level, but the parties can agree. In terms of the expanded FMLA, at least on my reading of it, an employer, if they have an already existing policy requiring the use and exhaustion of paid leave during FMLA leave, if they have an existing policy on that, I view it as the employer could also require the exhaustion and utilization of other paid leave during that period too, to make up the 2/3 amount. I think there's some disagreement on that, and I think that's an issue that will probably be litigated. The regulations itself almost appear contradictory related to that issue, but it's something to take into account. But I think that the safest practice is to have mutual agreement before you do that.
This is Ann too. I've seen some discussion of employees wanting to deplete their or use their personal leave before triggering this because they want to save this if down the road they need it. I guess if the employee's requesting it, I'm not sure there's a problem. I recommend not allowing it because I feel like it gets very complicated. When it's already very complicated about when these things are triggered or not. So, I would advise against doing that.
Okay, are we ready for the next slide then?
I believe so.
Okay.
Can I say one more thing? Sorry. That also where we had the question before about, and I think Erin already touched on this, but that first 2 weeks being unpaid, where that might come into play would be, say someone is subject to a self-quarantine per their healthcare provider and they get 2 weeks under that emergency paid sick leave. And then later on, they can't return to work because they're caring for a son or daughter due to the closed school or child care. They would still be entitled to that full weeks of job protected leave but that first 2 weeks would be unpaid or some other, they'd have to use their paid leave or something. That's when that unpaid provision kicks in, but it can be confusing. But in my mind, Aaron might disagree, only when they've used emergency paid sick leave for some other reason would that first 2 weeks be unpaid, or you'd consult with what your existing policies are for those 2 weeks.
Right. And of course, bringing up one point always opens up another with this, because this law is so convoluted. If you do utilize one form of the emergency paid sick leave, that's it. They don't get to utilize, make a different request for, let's say that you're told to be quarantined and you utilize leave for that purpose. You don't later on get to utilize leave for another purpose. Say if, the child care, closing of the child care, and that you would have the expanded FMLA leave for that. But basically it's a one-time thing for the emergency paid sick leave.
Oh, we did have one more question come in that I don't think we've talked about yet. So under that category 2, if an employee is advised to self-quarantine from a healthcare provider, what if they're able to telework or work from home during that time? So maybe a spouse is sick, and so they're self-quarantining because of that. If they're able to work from home, does this kick in?
Does it kick in? It could. It depends on how much work. There could be an intermittent usage of that if they work from home. Let's say that, I don't know. I guess I'm thinking if you have work for me to perform at home and telework, and I'm able to do that, and I'm self-quarantined, I think you could utilize some of this emergency paid sick leave for the part that you're not teleworking. I don't know if anyone else has a different view on that.
This is Ann. How I've been advising people is that if this is not triggered, if you can telework, of course, that's a presumption that they're going to be able to telework for their full hours. And I think that's where Aaron's like, well, if they can't, telework for their full hours. And that's what I've been telling people that are concerned that this might be subject to abuse. So if people are trying to be able to stay home under this and trigger one of these, try and see if you can figure out a way for them to telework or be able to take work home to keep them working, so that this is not triggered. And right now, the officials are really advocating for people to be able to work from home if at all possible. And I've been advising people to try and make plans for telework if shelter in place order is issued, that you've got an idea of who can perform what work remotely.
I would echo that, because I have not met any public employee that has nothing to do. Usually when we talk to them, they always have things that they push to the side or they can't get to. So if those things are able to be taken home or sent home with somebody to do, those are the things I would be looking at.
We're probably ready for the next slide.
All right.
Okay, so I'm going to cover who's excluded under the Act. So for this, the leaves that Aaron just reviewed, there's 2 exclusions, and that's healthcare provider and emergency responders. And they're discretionary exclusions. So it's up to you as the employer to decide whether you're going to allow healthcare providers and emergency responders the leave under the Families First Coronavirus Relief Act or not. What we're advising is to not allow it, because we really need to make sure these folks are coming to work. they're, the front lines of this, and we need to make sure they stay healthy. That doesn't mean you don't want to take care of these folks. So what we've been advising is that you either handle their COVID-19 related leaves on a case-by-case basis, or adopt a standalone policy that would apply just to healthcare providers and emergency responders. And I've drafted a sample of that looks something like they're entitled to maybe the COVID-19 related leaves under the FFCRA, except for care for a child under 18 due to school or daycare closure, because that's the one that seems to be, allow the most lengthy of leaves, and could frequently be, triggered by just frankly having a kid right now in the state of Iowa. Let's go into how the Department of Labor has defined healthcare provider. So as the slides show, these are employees at a doctor's office, hospital, healthcare clinic. It would include any of your public health employees, nursing or retirement facilities, as well as any labs. Now, this one I don't see as triggered as frequently for our city and county clients, except for that public health department employees. We can move on to the next slide. Emergency responder is the one that's broader. And I'm going to just read what the Department of Labor has said, who is an emergency responder. So for purposes of employees who can be excluded from paid sick leave or expanded family and medical leave, an emergency responder is anyone necessary for the provision of transport, care, health care, comfort, and nutrition of such patients or others needed for the response to COVID-19. This includes, but is not limited to, military or National Guard, law enforcement officers, correctional institution personnel, firefighters, emergency medical services personnel, physicians, nurses, public health personnel, emergency medical technicians, paramedics, emergency management personnel, 911 operators, child welfare workers, and service providers, public works personnel, and persons with skills or training in operating specialized equipment or other skills, as well as individuals who work for such facilities employing these individuals and whose work is necessary to maintain the operation of the facility. Also includes any individual whom the highest official of any state or territory, meaning the governor, determines is an emergency responder necessary for the state's response to COVID-19. And the DOL also encourages employers to be judicious when using this definition to exempt emergency responders from the FFCRA. So I know that there's a lot of words there, but for purposes of you guys, this is, this is your dispatchers, these are your jail staff, this is your paramedics, fire, of course, police, but it can be broader than that. It includes like public works personnel. So we're advising that, your secondary roads crews can also be classified as emergency responders. I know I've had a few questions, I can't think of them right now, about some other unique positions, but we've determined that even, if you operate, say, a home for disabled folks, it would apply to those. It applies to your emergency management staff. Now, what I've heard kind of around is that, some counties or employers are considering all of their staff emergency responders. And I've advised against that because, again, the Department of Labor is advising you to be judicious and, be more inclined to grant the leave. And, I personally think that, in a pandemic situation like this, there's certainly people that have to come to work, law enforcement and that kind of thing, but does a custodian necessarily need to be coming to work right now? Well, someone told me yesterday, well, I think they do because they need to be sanitizing and cleaning the courthouse or whatever. Well, I mean, there's a point, that is a good point. But my opinion right now is when the governor and everyone is trying to tell people to stay at home as much as possible, that, we should be analyzing this in terms of, who do we actually have to be there? And that's where we have a slide later on essential employees. And the way I've been advising on this is that I think essential employees is not interchangeable with emergency responder. I think essential employees is sort of a constantly evolving definition depending on the latest guidance from, the CDC and the government officials about the measures that need to be taken in terms of social distancing. Now, I think that that essential employees, has been interpreted really broadly and includes all government sector employees. But that's not of my opinion. Now, will you get in trouble if you classify everybody as a emergency responder? I don't know. I can't answer that question. But the point is, regardless, if any of these folks have some need for COVID-related leave, whether they're subject to a quarantine or have symptoms themselves, you need to determine how you're going to grant folks this leave as well. Do we have any specific questions on?
Yeah, we had a few come in of some examples. So there was a question if landfill transfer station workers were considered public works employees.
Yeah, I would say so. I know I didn't mention this either, but utility workers as well, we've been advising to consider emergency responders because we need those water treatment plants, and sewer treatment facilities to keep operating, on their 24/7 operations. And we've seen other measures being taken to stagger work shifts, alternate work weeks and stuff to try and, create a safer work environment for some of these workers that really need to be there.
There's also a question about senior meal deliverers, if they would fall into any of these excluded categories.
I haven't asked that one. I would think so, because you're kind of, you're ultimately kind of providing, I guess, emergency services in a way to help continue to feed, the needed population. What do you think, Aaron?
That's a tough one. That is a tough one. I don't know. I mean, the definition is broad. I think you could certainly make an argument for it. I think you can make a better argument.
Under your public health services.
That's true. It could fall underneath that. It would. That could be a different, complete different category. I think that may be better. But I think in the context, I think you could make an argument, and I think that's one of the key things is trying to make a good argument, not just say we want to have everyone be characterized as an emergency responder because of, just because we want to figure out a way to exclude it. I think you need to have a good, solid argument why. And I think if you can justify it in that sense, I think you're probably on fairly good ground. Now, you want to be flexible, not have everyone related to it. What I've been telling folks is, you identify kind of the critical infrastructure that you have, and you have the critical individuals who are necessary to maintain that critical infrastructure. So just because some operation is deemed critically necessary, that does not mean that every individual who falls within that division would be considered critical. So you got to look at it as a position by position issue. And there, I think you can certainly make an argument about senior meal delivery. I don't think you would get significant pushback in terms of a challenge with that. But again, I mean, that remains to be seen with this, because there are a lot of there are a lot of gray areas, and I think it's a lot of potential litigation going forward. Now, one thing I do want to just chime in on with respect to this is I've heard talk about a fourth possible stimulus package related to COVID-19. But within that, there has been a lot of talk about the possibility of narrowing this definition of emergency responder based on some dissatisfaction with it being as made as broad as it actually as it has been by the Department of Labor. So I don't know if that'll come to fruition or not, but it is something that is on the radar.
We had two other ones come in about this. Secondary roads employees.
Yes, I've been advising that they can be considered public works personnel and fall within the definition of emergency responder.
Okay.
That being said, I seems like a lot of the secondary roads crews are talking across the state and maybe just unhappy that they are being classified as emergency responders, but we're also advising to take precautions there. If you've got somebody that's high risk there, have them take the work truck home, and so no one else is in that work truck, and to stay wherever their substations or whatever are to minimize their interaction with one another or other county staff.
Another one we
and
have.
I guess.
Oh, sorry. Go ahead, Aaron.
I guess one thing I just would want to reiterate as well is, for the most part, what we're looking at is the child care provision, if due to a closure of child care facility or school. So we're dealing with that, and part of that component, there's a requirement that the individual is necessary to do that. So let's say if they have a spouse who is taking care of the child, they would not be necessary to provide to provide the support in that context. So we're dealing with somewhat of a narrow set there on things, because I think if individuals if they're sick or showing the symptoms or need to be quarantined, I think that's going to be done regardless in one way, shape, or form, even if they're technically excluded from the emergency paid sick leave provisions. I think that still, in terms of a good operation, you don't want someone who is sick or showing signs of being sick there. So I think it really boils down to the child care component, and there are some checks that can be utilized there on that. So I just thought that's something to take into account. And
you do want to be very deliberate in how you're applying this, because one thing is that some people think like that this is a new leave entitlement, a 2 weeks new leave bank that they get. No, it's COVID-19, related, and there are certain, even though this kind of seems like there's a lot of different reasons they can take it, but I've gotten calls where people have said, well, we heard that someone that works at Casey's had symptoms and is being tested, and our road guys always go to that Casey's and now they want to self-quarantine. Well, first of all, we don't have a positive diagnosis yet, right? And the panic can sort of spread like wildfire. And so, just because someone thinks someone somewhere that they may have had an interaction with has a cough, like, it doesn't trigger this necessarily. You just kind of, it doesn't hurt to hit pause for a second, let yourself, get back to your office, your area, look at your chart and go through the analysis before, you're granting these leaves.
So the one other one we had come in is a little bit different, but interesting. So volunteer firefighters. You're not talking about any sort of paid leave because they're volunteers. But the question is, what sort of ramifications could the city have, or liabilities could they face if the firefighters get exposed to COVID in a volunteer firefighter situation, and then they can't go to their regular jobs?
Well,
so this is Lisa. I'm going to throw a couple of things out here, Aaron, before you take that. So I think
right.
You have to be able to define so people traditionally call volunteer firefighters or non-full-time, part-time, regular firefighters volunteer. But I found that oftentimes they're still being paid. So whether it might be they're being paid as an independent contractor with a 1099, or they may be getting paid through payroll as a W-2, but it could be on a per call basis. So my understanding is if it's, that the W-2, they would be an employee. It would just be a little bit different. Correct?
And I think the other part is just you need to try and maintain the same sort of safety provisions you would for regular employees anyway within the workplace. It's, try to have distancing there to the extent you can. I think the same, OSHA has come out with, their suggestions with respect to things, and they largely follow the CDC's Centers for Disease Control, their recommendations with respect to dealing with it. And so I would say follow those best practices, and that's the best you can do.
And from a workers' compensation standpoint, volunteer firefighters should be covered by your workers' compensation policy. Now, some cities have the fire department separate and they have their own policy, and some cities it's part of the city policy. So you just have to be able to refer to your policy and know if they're covered or not. And if, again, like was asked before, if you feel that it was caused by the work environment, or then file the claim, and the claims examiner will do their investigation to see if it is indeed compensable or not.
So one last thing I just kind of want to touch on, and then we'll move on. We've had a lot of questions come in that have said something along the lines. So, okay, they're excluded under, an employee's excluded under one of these categories, but then what? What if they're both in these categories and their daycare closes, or they get sick, or someone in their immediate family gets sick? I think you've kind of touched on it, but so then what happens? This just means they're excluded from these additional paid leave benefits, but all the typical employer policies would still apply, correct?
Right. I think but this is a mandate. This is effectively a federal mandate, and the federal mandate would not apply to the emergency responder. Doesn't mean an employer can't provide it to the employees if they want to, but this just means the federal mandate does not apply. And employers, a lot of public employers go beyond what the very, very basic federal mandate is. But it's just, in terms of knowing what you have to do versus what you can do.
This is Ann. Like I said, that a lot of these, when it comes up that they, need to be quarantined themselves because they're exhibiting symptoms or care for a loved one or something. We're having people handle those on a case-by-case basis. Give them the leave if you can, and you don't have to deduct it from their leave banks. If you want to give them these 2 weeks of paid leave, if one of these are triggered for them, yeah, you can do that. And you can adopt a standalone policy where you provide, okay, what will we give these folks if one of these events are triggered? And for the daycare thing, even if they're not excluded here, I don't think we mentioned before, you can require, the Department of Labor has said, you can require them to basically confirm that there is no other suitable caregiver available. Of course, you shouldn't make them send them to grandma's house because grandma might be, of course, more at high risk. But, you can ask them to see if there's other suitable caregivers available.
Okay, we're ready for the next slide?
I think so. Okay, so right now, here we are. If someone is unable to work, this is the information that you can request them to provide. I know there's a prior question on that. So effectively what you can require them to provide is their name, the date or dates for the requested leave, and a statement of the COVID-19 related reason that the employee is requesting leave, and to include some sort of written support for that. It could be a doctor's note or something along those lines. And then a statement why the employee is unable to work or telework, just to include that. Now, there is some issue about whether doctor's notes and things like that should be required in this context. But I think if someone is being directed by a healthcare provider to be quarantined, I think it's very easy to get some sort of information there. Hey, can you give me some sort of notation to provide to my employer? So I see that as different, different from a return to work scenario. If, okay, I'm better, so now I need to come to work, and an employer is requiring someone to provide a doctor's note saying I'm okay, we're generally advising against that in line with the Center for Disease Control recommendation for not requiring return to work authorization. Next slide. So then now what we're going through is each of those different categories. If you remember that we talked about in terms of the emergency sick leave, and then with number 5, it pertains to emergency sick leave and expanded FMLA leave. So with the first category about the employee being under a federal, state, or local quarantine, what you need is the name of the government agency that was responsible for determining this quarantine. So let's say Governor Reynolds in a couple days decides there's a stay-at-home order, or folks are to be quarantined. I guess that would be a different category here. Well, that would technically apply. Never mind. So if it was that, that'd be pretty easy there. Explanation on number 2 would be an employee has been advised by a healthcare provider to self. So that would be the name of the medical provider and then a medical certification form. Then if an employee is experiencing symptoms of COVID-19 and seeking a medical diagnosis, and again, that would be a medical certification form that would be needed to verify this. Excuse me. Again, what I would want is that if an employee is experiencing symptoms and is not seeking a medical diagnosis, the emergency sick leave provision would not apply. So the fourth category, if the employee is caring for an individual who is subject to either a quarantine or isolation order or advised to self-quarantine, what an employer can require is the name of the individual and their relationship to the employee, the name of the governmental agency that was directing quarantine or isolation, the name of the medical provider if it pertains to again, this is a provision that applies to the emergency sick leave as well as the expanded FMLA leave. So what can be required there is the name and age of the child, the name of the school or place of care, and as well as an indication that no other person will be able to care for the child. So just a statement attesting to that fact. Now, I've had a lot of questions related to, there's a lot naive to say that folks may, that there is nobody who would take advantage of this, or undue advantage. And folks want to know how to, and I think you do the same sort of analysis as a potential abuse of sick leave. You can request some sort of verification on it. Let's say if, one thing that was that's been relayed to me a couple times is, what if they don't even have a kid? They put something down. Well, then you verify that. It's not. We're not advising folks to overly police things here, but if there is a suspicion of abuse, that is something that you all, as an employer, can get into, just like any other abuse of leave. And then
I have a question on that one.
Yeah.
They want if they could require the verification to come from the daycare provider, or if they have to accept just verification from the employee.
Well, there are some postings. Generally, what we suggest is some sort of confirming information. If it's that, get me some sort of indication. Now, obviously, in a school sense, you wouldn't need to get that necessarily. I mean, you could ask for the public notice, I suppose, but I don't think it's a secret that schools are currently closed now due to the governor's emergency declaration. But it's I don't see any problem requesting that information.
And then we also had a question.
And it could even be an email from, let's say it's a small home provider. It could even be just a note or an email from them saying, yeah, we're closed due to COVID-19 concerns.
Okay. There's also a question. Number 4, the 4th category included caring for an elderly parent.
Yes. Okay. But does it include, is that the question, does it include caring for an elderly parent?
Correct.
Let me look at that. I believe it does. Do you know off the top of your head, Ann?
I think so long as that you had a notice from that elderly parent caregiver that they're supposed to be quarantined.
Yeah, that's my understanding, is that would apply as well.
This is Lisa. I think too is good to note here that this one is for children 15 and old or 14 and younger. So if you wouldn't be able to claim
I think
this
it's
for a
18.
child.
I think
thought it was 14, and I've read, we can verify this, but I read 14 and younger. And if you need to care for somebody older, 15 and older, you have to provide notice of why they're a special care. The care. I'll find where I read that, but.
Okay. Yeah, I thought it was, and I could definitely be wrong on this, but I thought it was if someone is 18 and under, and I remember it sticking out because I thought it was bizarre that the senior in high school, if schools closed, that they would need me to come home and watch over them.
I thought it was 18 and under as well, or an adult child incapable of self-care, and but I'm looking on the DOL's FAQs right now. I'm sure we can track down an answer on that. But I mean, regardless, I think if it is a high school student, you can legitimately ask, do you need to be there? Which I was talking to someone yesterday, and I thought, those high schoolers might be more inclined to get into trouble than a 10-year-old if they're left to their own devices all day. But I don't know if that's a legitimate reason to trigger this leave, but I don't know. Should we keep moving on and we can maybe circle back in that at the end to get a confirmation?
Sounds good to me.
Are we ready for the next slide then?
Well, maybe. I just pulled up the regulation. What it's defined as, it's a need for leave to care for the son or daughter under 18 years of age of such employee if the school or place of care has been closed or the child care provider of such son or daughter is unavailable due to a public health emergency. And what they did was they expanded the application to include over 18 years if the son or daughter is unable to care for themselves. Due to a mental or physical disability. And that would be on page 11 and 12 of the federal regulations. Okay, so yeah, I think we're ready to move now.
Okay, so now we're on to the slide that just shows the required posting. Hopefully you guys are all familiar with this. As of April 1st, this is the poster that needed to be, distributed or posted at your work sites, just like your other kind of federal law posters, employment law postings. You can also email it to employees. You can find this if you just Google, FFCRA poster. This will pop up, notifying employees who's eligible and what their job protected leaves are. I think we can move on to the next slide. Okay, here we get to the intermittent leave. It's not guaranteed that you can use your leaves intermittently, either emergency paid sick or under the child care expanded FMLA. The employer has to agree to it. If the employees are still physically working at the workplace, they cannot use intermittent leave. But if employees are teleworking or working remotely, if you guys agree to it, it can intermittent leave can be used for any of the 6 reasons. And I think this can get pretty complicated. Again, if you write something down during this presentation, I would write down, Department of Labor FFCRA questions. And if you Google that, the Department of Labor is constantly updating guidance on this. Right now, I think they've got about 79 or 89 FAQs. And questions 21, actually starting at question 20 through like 22, 23, all address some of this use of intermittent leave. And kind of explains in the different scenarios when someone can use intermittent leave and when they cannot. Now, the idea is that if they're still coming into the workplace, they should be working full days, right? And not using it intermittently. If you're allowing telework, especially if they're teleworking and caring for children, there's been clients that have said, no, we're not going to allow telework period if you're going to be caring for the children, because we just don't think you're going to really be able to complete your work. Then we've got some that allow it and allow this flexibility, get your work done. We don't need you to track your hours. If you can get a day's work done, whether that work's done before 6 a.m. and after 8 p.m., that's okay. Then there's other people that want them to be, available between the hours of 8 and 4:30, and so we're not going to allow, either the telework or if you're caring for the child. But then if you want them to track it, you might have them track their time between 8 and 4:30, and it shows 9:30, and then I worked again from 11 to noon, and then again 3 to 5. But that gets very complicated, I think, to administratively then track, okay, how many hours have they used? But that technically it's allowed under the Department of Labor regulations. But I'd recommend, if you have intermittent leave questions, consult, your legal counsel, or definitely go look at those FAQs to figure out what your particular situation is. I don't know, Erin, do you have any other thoughts on it, or do we have specific questions on this?
I think the one exception is in the in the child care context. I think if someone is still physically working at the workplace, I think allowing for the intermittent use of leave for that purpose would make sense.
Right.
If there's someone, let's say I'm able to do Monday, Wednesday, Friday, and my spouse is able to do Tuesday and Thursday, and so we alternate in that sense. So that's one context where intermittent leave would make sense if you're still physically working at the workplace. Otherwise, not.
And the other thing I think where it gets confusing here as well is that emergency paid sick leave for 80 hours or 2 weeks equivalent. The idea is that if one of those are triggered, the employee is off if they can't also telework, and until that condition ends. So let's say a doctor recommends self-quarantine, but they just recommend self-quarantine for 7 days. So they would be out for 7 days, then they could come back in, even though they hadn't used that full 2 weeks, right? It doesn't have to be taken a full 2 week chunk.
But then, do you share the same understanding as me, Ann, that with that, it then could not be utilized for another purpose, the sick leave?
I don't know if they'd only use 1 week. I guess I don't know the answer to that question.
And I do think that's a gray area there. Does anyone else here have thoughts on that? That's just a gray area that I'm not entirely sure on.
I thought we finally had all the answers.
Actually, what I'll do as you cover the other slides, let me look at the administrative regulations, and I'll come back with an answer.
Okay. If we don't have any other questions on intermittent leave, we can move to the next slide. So this is just giving some advice on how you should track the time and do the payroll for this type of leave. We've put out there some policies and documents on teleworking. There's some good examples out there where you make an agreement for what specific hours they're going to be allowed to work from home. Again, I guess it's a policy decision on how much you're going to require them to document what work and tasks they work on and what hours they spend working on it. That's up to you. But we think it is definitely important for you to create separate pay codes for this paid sick leave and expanded FMLA. Right now, if people are using it, right now, the government has, for private sector employers, employees are not going to be charged. For private sector employers are not going to be charged for, or they're supposed to be reimbursed for all of these paid leaves, right? But that relief has not been given to public sector employers yet. But we're recommending tracking it because, as Erin kind of mentioned before, there is constant discussion of further relief potentially being issued. So if there's some way we can recoup these costs for these additional paid leaves, that needs to be tracked. And of course, you're going to want to track what health plan expenses are being deducted, and any of the required forms and documentation from the employee, like you would any other, FMLA type leave. Any questions on tracking time and payroll? I hate to see that we're running out of time and we haven't even gotten to unemployment stuff yet, but so I'll try and move a little more quickly.
We just had a couple.
Say quick. This is Lisa. So that 14 that I read, that was based off the IRS guidelines for tracking. So I apologize. So the IRS was saying that they would want additional documentation if you're going to claim that tax credit. So that's where that came from.
Okay.
Oh, okay. Good to know.
Okay, so that was one of the questions I think you already covered, that public employers don't yet qualify for those tax credits related to this leave. The other one was if this paid leave is subject to income tax and FICA.
Has been asked over and over again, and we're not tax experts by any means. And when I read through the FFCRA, my understanding is that it clearly said that FICA taxes did not need to be deducted from employees' paychecks for these paid leaves. But it's my understanding that the IRS, in fact, one of our county auditors reached out to Senator Grassley and Senator Ernst's offices, and they responded back that right now that you should just continue to basically do your deductions as standard practice, and that there was no actual allowance to not deduct it. It's like a deferral program where you can defer paying those taxes over a period of 2 years or something. So my latest, you probably heard very inconsistent information even from us on this, and I apologize, but my latest advice is keep deducting taxes as you always have. That you can't go wrong that way, and that's I guess what the latest advice is on it.
Yeah, it really seems like there's major disagreement between folks. I mean, you talk to different attorneys, you talk to different outside auditors or accountants. There are different takes on this whole issue, and so what we, as Ann mentioned, what we're advising at this point in time is just the safest approach. Attorneys are generally cautious in this sense, and we encourage the safest approach is just keep on doing what you're doing.
Okay, we ready for the next slide then?
Mm-hmm. Okay, I guess I don't remember the slide, sorry, after reviewing it. So yes, certainly these are the basic protections that you can't deny an employee the FFCRA paid leave if they are, if one of those COVID reasons is triggered and they can't telework. I don't think you can require them to use other paid leave before granting them this additional emergency paid leave. Oh yeah, here we go. But employees can supplement that 2/3 leave with their own banked leave with that to get a full paycheck. Now I don't think they can be required to, but you can allow that so they can get a full paycheck. Now I know some folks are allowing only to get the 2/3 pay because they want employees to be incentivized to get back to work or to find alternative childcare and not be getting a full paycheck. But that is a policy decision that you guys can make as employers as to whether you allow them to supplement or not.
I would.
I know a couple people came on.
Yeah. And just keep moving on, and then take questions more than anything.
Okay. We can move on.
Well, I just think really you can kind of go through them quickly and then hit the meat of questions for the last 10 minutes.
I'm not going to spend a lot of time on this because this is just sort of what the enforcement provisions are, but they're not enforcing it till April 17th, and there's some defenses there if you were making good faith efforts to comply with the act and there was not a willful violation. And then on the next slide, it shows sort of the enforcement or liability. It's kind of just your standard damages that are allowed by other, say if you were in violation of the Fair Labor Standards Act or overtime provisions. There's liquidated damages, which basically just doubles the damages, attorney fees, and court costs, that kind of thing. And then the next slide, this is Lisa provided this guidance of where how people are being defined as, you know, essential critical infrastructure. So I think this is what a lot of you guys might be looking at on your disaster plans or pandemic plans about who you're identifying as essential. I guess the only thing I would say is that, again, I'd reiterate that I don't think essential is the same thing as emergency responder, in my opinion. And I think that can be confusing. I don't know what Erin or Lisa, if you've got some other advice on how you're advising clients on making this essential employee determination.
What I've done is again, I think you just identify what sort of critical infrastructure there is, and then you identify those critical individuals within that in order to maintain that critical infrastructure. So it's doesn't necessarily mean that everyone in you know, in like a public safety context, I suppose, it doesn't mean that necessarily everybody there is essential. It may be, but I think you need to look at it on a position by position basis. So just because something pertains to infrastructure, I don't think you identify them as an essential individual. Now, the inconsistency that we receive on this is from the governor herself, who it proclaimed, and this was recently in terms of conversation on a possible stay-home order, or stay-in-place order, was the fact that she indicated that she estimated about 80% of the employees, of current employees, would effectively be essential in that context. So based on her reading, it's incredibly broad. So, you know, I don't know where things would play out there, but I think it's something that you all need to think about and try to identify and do that.
And we did have a question come in earlier about this idea if there was a shelter in place. And, you know, this is all kind of talking hypotheticals, but they were wondering if that happened, if employees that were considered essential or emergency responders, if they would need some sort of letter to continue to go to and from work.
Maybe.
Yeah.
Yeah.
Yeah, I think people are starting to create that documentation. One client I talked to yesterday was going to provide them for all employees for right now, so they're prepared. And then if that time comes, then ultimately decide, okay, who do we think is essential at this time? So that's one way to go about it. I think other people have just told people to make sure you have your work badges, with you. So if you were to get pulled over, and especially in small communities, people know who each other is. I don't know that it's going to come to having National Guard patrol the streets, but if it did, that's probably the documentation that people would need.
Right, and another question I got is about contractors. If you bring a contractor on, and so one thing that I've advised is to provide a letter to the contractor themselves to carry around, because there was an issue about, well, should the employer issue a badge to the individual even though they're not a county employee? And so it's decided just provide a letter explaining the situation and the services they'd be providing. We good to go to the next slide? Okay, so this is basically what we have here is just an identification of the two different types of pay that really would apply. This past hour and almost a half now, we've focused largely on the FFCRA and the emergency sick leave and expanded FMLA provisions. And so with that, want to say that those only apply if there's work available. If there's not work available, I mean, there are some employers who have made the determination we're just going to pay folks anyway. But in a technical sense, in that context, you're able to furlough employees. And in that sense, furloughed employees would be eligible for filing for unemployment with Iowa Workforce Development. And my understanding on things is that it could also be if there's a reduction in hours, if employees need to work less, that Iowa Workforce Development would cover those employees with unemployment compensation. And the other part of the unemployment compensation is that the state, at least as it currently stands with respect to things, is the state would be covering the costs of that. It would not be on the individual employer picking up those costs. And there's also another provision that it's not 100% clear on how it would apply. There was the most recent, I guess, stimulus or COVID number 3, that was the CARES Act, that in what it involved is essentially allocating an additional $600 above what the state would be providing to individual employees. And the mechanism and the specifics for that are not entirely known, but it's something that there may be some sort of enhanced benefit for a particular period of time there if someone is furloughed or laid off. Next slide. In terms of unemployment insurance, what Iowa Workforce Development is utilizing a streamlined process because there's so many claims being filed right now, and so they're excluding a lot of the requirements for things about work searches and fact-finding interview, things like that. They're going away with that for the particular period of time related to COVID-19. But now also, there, as I had alluded to, there are several different sorts of options that are available. Employees are entitled to a wide without pay. It appears, based on my review of everything, that the individual would qualify for unemployment compensation for that period of time. So if there's any time when an employee is either has incurred a reduction in hours worked, or is sent home and is on leave without pay due to COVID-19, or if they're furloughed, I think what the employer should do is encourage the employee to reach out to Iowa Workforce Development on that, and contact them related to COVID-19. And I think for the most part, they would end up getting coverage.
We had a question come in. Part-time employees qualify for unemployment?
I believe so, yeah.
This is Ann, if I can jump in for a second. So, and I can't remember, Aaron, is there another unemployment slide, or is?
I think this is it.
Oh, okay. I just wanted to explain. So yeah, because it kind of tags on with this question. So people can qualify for unemployment in sort of a variety of ways. So one, let's say you reduce their work hours, say from 35 to 20 hours a week. They could go file unemployment for that reduction in work hours. Alternatively, maybe you're staggering work schedules now. So you've got one half your crew coming in 1 week, and then the other week they stay home while the other crew comes in and works a week to create more distance. They could file for unemployment for those weeks that they are not in the office. So one reason why you might do that is because you could continue to give them health insurance benefits, and they would still be getting some pay so that you could deduct their share of the premiums from those paychecks that they're still getting paid. A third option would be furloughing employees, and what we think of that as in terms of a work stoppage where a factory might close for a month for retooling or updates. In that situation, they could also collect unemployment for that furlough, and you could continue giving them health insurance benefits. In either of those three scenarios, you're going to want to check with your health insurance provider to ensure that those furloughed or employees or reduced work folks can continue on their insurance. And it's our understanding, at least Wellmark is allowing those folks to stay on. And I just heard that through the grapevine. I haven't talked with anybody there myself, and then you still have the traditional laid off folks that could be, where you're eliminating the position for the foreseeable future, in which case they would go on COBRA.
We had a couple questions come in. If someone is not working for various reasons, whether they don't have the work to do right now or they go home for fear of getting the virus, are they required to use their paid leave benefits before they would qualify for unemployment?
Well, this, as a lot of things have, as this has been the case for a lot of things over the past couple of weeks, it's been something that's gone back and forth. Initially, Iowa Workforce Development was adamant that all forms of paid leave had to be exhausted before an individual would qualify for unemployment, but that has recently changed, so it is no longer required. So the answer is no.
And then the other one came up: if someone goes home because of this fear of getting the virus, they may qualify for unemployment. I think that's been mentioned, but if the employer needs the work to be done, can they try to fill that position, or do they have to hold the position for them?
I suppose it depends on the essential nature of it. If you filled it with a temporary individual, I probably wouldn't. I would stay away from a permanent replacement based on that. Are there any other questions?
There was a question about, I don't know if I want to call it an intermittent, but in terms of unemployment. So can they have unemployment one week and then work the next week and then have unemployment the next week if you're doing kind of a rotating schedule type process?
It looks like the answer to that would be yes. But again, we're dealing in kind of a gray area. What we would encourage is that if that is the case, that the employee contact Iowa Workforce Development and see if they can qualify to receive unemployment for that purpose. The suggestion from the FAQs and everything that has been that Iowa Workforce Development has released suggests that they would qualify, but administratively, I'm not sure how soon employees would receive money and everything, because I envision that there's a huge backlog. So really the best advice I would have is encourage the employees to reach out. And one idea, if someone is put on such a staggered scheduling, that the employer provides some brief indication in writing that that's the case and that it's due to the COVID-19 public health crisis. Therefore, trying to assure that the unemployment costs would not be attributed to the employer.
And we had a few questions come in about the CARES Act and funding or reimbursement related to that. I will just say that at least for ISAC members, we are working on an additional webinar for that. So we'll kind of hold those questions for the time being. So I think that's all I'm seeing, unless anybody else has something. The speakers have something.
So there were a few questions on the next slide. I don't know if you wanted us to address those. I think the first one Anna answered. Okay, so question one, that's been answered. Question two about how we pay an employee who is off for child care for a part-time situation with shared custody. That would be an intermittent leave scenario. I would encourage employers to allow for the intermittent use to try and stagger that. And then question three about what happens if an employer wants to pay staff that are off due to no work and unemployment.
I think that came more from like a city saying, hey, we're going to pay, or like a library board saying, we're going to pay our library staff to stay home because they've closed the library and they're not doing, you know, curbside book checkout. So instead of having those employees get unemployment, we're going to, as the library board or whatever department, Parks and Rec, we're going to pay those employees their full wages even though they're at home. How do you deal with, one, can that be done? And two, how do you deal with that when, say, your maybe more essential departments like public works are having to work for their pay? What's your opinion on that?
Well, it's a tough situation. We hear this whole thing a lot, and it is, first of all, can you do it? Yes, you can do it. But it does pose an issue because there are a lot of folks that there's resentment from those folks who do need to come into work. They want to know, well, so-and-so's getting paid for being at home, not doing anything, and I have to go out here and work and potentially expose myself to COVID-19 and some of those other risks, and I get paid, paid the same sort of thing. I get my regular rate of pay just like the other person is, but I'm having to go out and do this. Now, the one thing that some employers have done is they've provided where one who has decided, well, we'll pay overtime to those, and this was a shorter period initially after the first emergency proclamation by the governor. But for those who needed to come in, they paid them overtime. There's been some talk about some sort of hazard pay, some sort of additional enhanced pay for those who have to go to work. Some folks just can't cover that cost. And so it's either you have to deal with the resentment, or an alternative is furloughing those employees who don't have work to do. And then at that point, it's that resentment. I mean, you might have resentment from those employees who get furloughed, but for those who are actually doing the work, they may still not be happy that they're getting just their regular rate of pay, but that argument goes by the wayside about folks getting paid by the employer for sitting at home doing nothing.
I had two more questions come in that maybe we could touch on real quickly, and then we'll wrap up. One that I don't think we've talked a lot about yet is how unions might impact this, and if you're dealing with union employees.
Well, most unions have been very cooperative on this. I think it's a dialogue, sit down and have a conversation with the unions about what to do. And a lot of these situations, like if you want to go to a staggered sort of scheduling, I had one city recently that what they were looking at is for dispatchers, having 1 week on, having a group of dispatchers just working 7 consecutive days, and then another group working 7 consecutive days and alternating that way, completely against the terms of the contract. But there were concerns about, well, if anyone gets, if there's too much exposure and too many people get sick, that, well, it probably will be, it'll go somewhere else, picked up by the county or something else, and then that work, we will no longer have that work. And so talking to the union, most unions recognize the issues here, and they know it's a time to work together on it. And it's not a good PR move if the union is resistant to efforts to try and make things work out for the best for everyone. But there is the real significant potential of a long-time layoff or furlough, maybe a permanent reduction in force if work has to go out elsewhere in order to get it done. So there is an interest in having a conversation. For the most part, there's a couple of unions I've dealt with who have been very difficult, but other than those two, really every other union has been very cooperative.
These leaves do apply to seasonal workers, and I've seen some email on some listservs that people are sort of holding off right now on hiring. I don't know what you've heard, Aaron.
Yeah, I've heard the same thing because the emergency sick leave would apply immediately for a seasonal worker. If you need to do it and bring them on, you can, but these leave provisions will apply. And once they're there for 30 days, the enhanced FMLA provisions would apply as well. So it really is, it's a judgment call, but I do know a lot of folks are holding off right now.
I'm going to ask a question regarding that. So I've found that sometimes our employers will terminate an employee at the end of the season, and sometimes they keep them on the books but just lay them off or have them not go back. So how would that come into play, say, if they didn't necessarily terminate them and they didn't hire them back in the spring, but they just left them on? In theory, if they worked within those 6 months, they could be covered in that average, but does that make any difference to this situation?
Well, I think in terms of, I can't remember what iteration of all of this that I saw that, but I think in terms of whether, like, we're looking at the 30 days of an employee context, that I recall seeing something that indicates that it's how long an employee is on payroll. If they're there on payroll, then during that period, then they still would qualify for the 30 days. It was at least my reading of it. You have a different read, Ann?
No, I don't have anything to add on that because I'm actually not sure. You think you're ahead of me on that one.
Yeah,
Okay.
so I think that's a very real possibility. So.
Well, with that, I think we'll wrap up, and thank you so much for everyone that hung with us for about an extra 15 minutes there. Thank you so much to our speakers. As you can see, this is a lot of information, and we really appreciate you taking the time to kind of go over it with everyone, and just the time that you must have spent to digest all this is enormous. So thank you so much. A couple housekeeping things. So if you're still on the webinar right now, you can grab the PowerPoints that are under the handouts. We will also post the PowerPoint on our website along with a recording of the webinar. So if you need to refer to it later. And like I said, watch for more content along these lines on this pandemic from us. So if you have questions, please keep them coming, because that's where we get our ideas for this information. Thank you to everyone that is on the webinar and participated. I know you're all very busy right now, so we appreciate your participation and all the great questions that came in today. And once again, I'd like to thank our speakers for their time. We really appreciate it.
Thank you, Christy.
Yes, thanks so much. Everyone have a good day.
You too. Stay healthy.
Bye.